Herniology represents one of the dominant domains of modern surgery, and this has seen an evolution over the centuries, especially in accelerated growth, both in its understanding and in the betterment of techniques and technology to repair hernias across the world. The first has been the key understanding that we can repair hernias in a more physiological fashion, and this has seen the scientific progress over the last 100 years or more. This has been accentuated by the growth of bioprosthesis, especially meshes, in the reinforcement of the abdominal wall. And lastly, but not the least, has been the virtual explosion in the application of minimal access surgical technique, both in laparoscopic as well as in robotic surgical technologies. We now are at the very cusp of seeing a radical improvement in the way we approach and treat hernias.